Okay, hello, welcome. Welcome to my channel. So, today we are going to learn about the structure and function of the male reproductive system. Okay, so today specifically we are talking about the male reproductive system. Okay, so let's start. Okay, so the male reproductive system, like that of the female, consists of organs whose function is to accomplish reproduction. Okay. Then this is this is what we are referring to as the male reproductive system. Okay. Then in terms of the organs, that the male reproductive system consists of, we talk of the it has two testes in the which are found in the scrotum. Then of course there is one penis. There are two spermatic cords. There are two seminal vesicles. There are two ejaculatory ducts, and there is one prostate gland. So these are the organs that are consisted uh, in the male reproductive system. Okay, then for us to go in details about the organs, we're going to separate them into external and internal organs. So starting with the external organs, so the external male reproductive organs and the structure includes the following. So we have the scrotum, of the testis, of the penis, and also thus we have to now look at each of these structures in details. So let's start. So this is the scrotum here. Okay, so the scrotum, and of course is supporting structure for the testes. So this is outside. That is the scrotum. Okay, so the scrotum is a pouch of deeply pigmented skin, fibrous and connective tissue, and smooth muscle. It is divided into two compartments, of which each contains one testis. So in short, they were saying there is one testis in each of the two compartments. Okay, then there's also one epididymis, and there is the testicular end of the spermatic cord, and it lies deep below the symphysis pubis, then in front of the upper parts of the thighs and behind the penis. That's where you can find the scrotum. Okay, so the layers of the scrotum. So what are the layers of the scrotum? So layers of the scrotum is in mnemonic, which is some Dan Englishman called it the testis. So S is for the skin, D is for the dartos fascia and the dartos muscle, then E is external somatic fascia, C is for the cremasteric fascia, I is internal somatic fascia, T is the tunica vaginalis, and the last T is the tunica albuginea. Okay, so this is what from superficial to deep. So this is how it is from superficial to deep. Okay. So next structure we're going to talk about the testis. So this is actually the testis. Now a sagittal section of the testis. And this is what we are seeing inside the testis. These are seminiferous tubules. Okay. So the testes are the reproductive glands of the male and the equivalent to the ovaries in the female. They are about 4.5 centimeters long, 2.5 centimeters wide, and 3 centimeters thick, and are suspended in the scrotum by the spermatic cords. Then they are surrounded by the following three layers of tissue. The testis has one layer, which we call the tunica vaginalis. It also has one layer of tissue called the tunica albuginea. Then there is also a tunica vesiculosa. So those are the three layers of tissue that surrounds the testis. And this, of course, now if you're viewing it from inside, that's how it actually going to look like. Then the three layers, we have the tunica vaginalis, the tunica albuginea, then the tunica vesiculosa. So this is the testis in terms of structure. From the superior view, the lateral view of the testis and the associated structures, then of course as well as the sagittal view. Okay. So let's now look at the structures. Number one, we're going to look at the tunica vaginalis. So the tunica vaginalis is a double membrane forming the outer covering of the testis and is a down growth of the abdominal and pelvic peritoneum. During early fetal life, the testes develop in the lumbar region of the abdominal cavity, just below the kidneys. So in short, we are saying when someone during a fetal life, during embryology, the testes actually are located in the lumbar region, just below the kidneys, and they then descend into the scrotum, taking with them the coverings of the peritoneum, blood and the lymph vessels, nerves, and the different ducts. Okay? Then the peritoneum eventually surrounds the testis in the scrotum and becomes detached from the abdominal peritoneum. Then the descent of the testis into the scrotum should be complete by the 80th month of fetal life. So that's why we say it's very important to check the scrotum for a newborn, a neonate, and as well as they become to their infant in their infant. So because there are some who have what we call an undescended testis, where the test fails to descend. Okay, so these are some of the things we need to know. Okay, so recap, we're saying the testes are found in the lumbar region, specifically in the retroperitoneum. Then they begin to descend. After they descend, and then that's when they go into the scrotum. And they take with them the coverings of the peritoneum, blood, lymph, nerves, and the different duct. Okay, then next is the tunica albuginea. So this is the fibrous covering beneath the tunica vaginalis that surrounds the testis. In growth form septa dividing the glandular structure of the testis into lobules. Then lastly, you have the tunica vesiculosa, which consists of a network of capillaries supported by delicate connective tissue. So these are the three layers of tissue that surrounds them. Okay. Then in each testis there are 200 to 300 lobules, and within each lobule there are 1 to 4 convoluted loops composed of germinal epithelial cells called seminiferous tubules. Then between the tubules are groups of interstitial cells that secrete the hormone testosterone after the onset of puberty. That's about the in between the tubules themselves inside the testis. We're saying they are a group of interstitial cells. Okay. Then at the upper pole of the testis, the tubules combine to form a single tube. Then this tubule, the tubules combine to form a single tubule. Then this tubule, about 6 meters in its full length, is repeatedly folded and tightly packed into a mass called the epididymis. Okay, so that's what about the structure of the testis. And then after the epididymis, then it leaves the scrotum as the different ducts or the vas deferens in the spermatic cord. Then blood and lymph vessels pass through the testis in the spermatic cord. So in short, it goes and joins the upper portion of the spermatic cord, or the portion of the spermatic cord. Okay. Then in terms of functions, what are the functions of the testis? So function number one, of course, we talk of in terms of spermatozoa, or the sperms. So the sperms are produced in the seminiferous tubules of the testis, and they mature as they pass through the long and convoluted epididymis, where they are stored. So function of the epididymis is for storing the sperms. I don't know why, if you ask students, they totally forget this, and they have been learning this since biology. Okay, So I don't know why people forget this. Okay, then the next thing, apart from formation of the sperms and of course storing of the sperms, the hormone, or the other function is that you have to know that there is a hormone which controls sperm production, which is follicle stimulating hormone. So in short, follicle stimulating hormone is from the anterior pituitary gland, and it's not only found in females, and even in males there is follicle stimulating hormone. Then in males, the follicle stimulating hormone stimulates the sperm production. It activates the production of sperms. Then a mature sperm has a head, a body, a long whip-like tail that is used for motility. Then the head is almost completely filled by the nucleus containing its DNA. It also contains enzymes required to penetrate the outer layers of the ovum to reach and fuse with its nucleus. And the other thing you have to know about the follicle stimulating hormone is that so for this one, there are specific hormones, or there are specific cells that are stimulated by the follicle stimulating hormone, and those same specific cells are cells we need to differentiate, and I think we will also talk about them in details. Okay, so that's what you also need. That's what you also need to know. So you come and talk about those cells, but just know that for follicle stimulating hormone, there are special cells which we call the Sertoli cells. Those ones are stimulated by the follicle stimulating hormone so that they initiate the process of spermatogenesis. So Sertoli cells that are also stimulated by the follicle stimulating hormone to initiate spermatogenesis. Okay, then let's continue with the structure of the sperm. So the body of the sperm is packed with mitochondria, which fuel the propelling action of the tail that powers the sperm on its journey into the female reproductive tract. Then successful spermatogenesis takes place at a temperature about 3 degrees below normal body temperature. So the testes are cooled by their position outside the abdominal cavity, and the thin outer covering of the scrotum has a very little insulating fat. So in short, the easiest way to remember this is that the reason why the testes are found outside the human body, or why they are not found inside, is because actually the testes can't function at the normal body temperature. They need a temperature that is below the normal one. So meaning if they were to have the same the same temperature with their body, they can't function, they can't produce sperm, and that's why they are found outside. Okay, so that now they can perform their function of spermatogenesis. Okay, so this is the structure of a sperm, or parts of a sperm cell. Then you have to know that about 300 million sperms mature each day. You have the head and the tail. Then the head is made up of an acrosome and a big nucleus. Then the tail, of course, before we go to in between the tail, there is what you call the neck. Then the neck, of course, I'll find that there is a huge power of mitochondria in the mid piece. Okay, so there's the neck and the huge power of mitochondria in the middle piece. Then you have the principal piece, which is of course part of the tail, and the end piece of the tail. And this is the structure of a sperm. Okay, so what are the hormonal control of the testes? So although the initiating factors are unknown, at puberty certain hypothalamic neurosecretory cells increase their secretion of gonadotropin releasing hormone. Okay, then what happens? So this hormone intends stimulating the gonadotrophs in the anterior pituitary to increase the secretion of two gonadotropins. So number one, luteinizing hormone and follicle stimulating hormone. Okay, so luteinizing hormone stimulates the Leydig cells, or specifically stimulates the interstitial cells of Leydig, which are located between the seminiferous tubules, to secrete the hormone testosterone. I remember there was a student who asked me what's the difference between interstitial cells and Leydig cells. So other literatures call the Leydig cells, or call the interstitial cells to say interstitial cells of Leydig. So it just depends on the literature. So interstitial cells of Leydig. So you have to remember the interstitial cells of Leydig are the ones that are stimulated by the luteinizing hormone to produce testosterone. So in short, we are saying Leydig cells are also known as testicular interstitial cells. Okay, that's what we are saying here. Okay, so then this same testosterone is a steroid hormone that is synthesized from cholesterol in the testes and is the principal androgen. It is lipid soluble and readily diffuses out of the Leydig cells into the interstitial fluid and then into blood. So then into the blood. Then via negative feedback, testosterone suppresses secretion of luteinizing hormone by the anterior pituitary hormone gonadotrophs and suppresses secretion of the gonadotropin releasing hormone by hypothalamic neurosecretory cells. Okay, then in some target cells, such as those in the external genitals and prostate, the enzyme 5-alpha reductase converts testosterone to another androgen called dihydrotestosterone. So DHT, dihydrotestosterone. Okay, so that's what you have to know. Then that's it about luteinizing hormone and the interstitial cells of Leydig. Let's now talk about the follicle-stimulating hormone. So the follicle-stimulating hormone acts indirectly to stimulate spermatogenesis. So in short, it stimulates the Sertoli cells. The Sertoli cells more like activates now the spermatogenesis. But the one which now causes maturation of the sperms, or which causes the sperms to mature during spermatogenesis, is testosterone. So meaning testosterone is still the one which will finish up the process that was started by the follicle stimulating hormone. Okay, so follicle stimulating hormone and testosterone act synergistically on the Sertoli cells to stimulate secretion of the androgen binding protein, which is the BP, into the lumen of the seminiferous tubules and into the interstitial fluid around the spermatogenic cells. Okay, then the same ABP which has been formed binds to testosterone, keeping its concentration high. Then testosterone stimulates the final steps of spermatogenesis in the seminiferous tubules. Okay, so then once the degree of spermatogenesis required for male reproduction functions has been achieved, the Sertoli cells release inhibin, which is a protein hormone named for its role in inhibiting follicle-stimulating hormone secretion by the anterior pituitary gland. Then if spermatogenesis is proceeding too slowly, then of course less inhibin is released, which permits more follicle-stimulating hormone secretion and an increased rate of spermatogenesis. Okay, so we are done with the testes. Okay, now let's look at the penis. So this is the structure of the penis, and this is the frontal section. You have the external urethral orifice, you have the glans, you have the coronal, okay, and of course you may find the prepuce or the foreskin. Then you have the urethra here. Okay, then that's the penis, and you can also have the erectile tissues. The erectile tissues, we have the two cavernosa, the corpora cavernosa of the penis, and there's one which surrounds the urethra, which is the corpus spongiosum. Okay, so the penis has a root and a body. The root lies in the perineum, and the body surrounds the urethra. It is formed by three cylindrical masses of erectile tissues and involuntary muscle. The erectile tissue is supported by fibrous tissue covered with skin and has a rich blood supply. The two lateral columns are called the corpora cavernosa, and the column between them containing the urethra is the corpus spongiosum. Then at the tip of the penis is a triangular structure known as the glans penis. Just above the glans penis, the skin is folded upon itself and forms a movable double layer known as the foreskin, or also known as the prepuce. Okay, so these are the two erectile tissues which we call the corpus cavernosa or the corpora cavernosa. Then this one here is another erectile tissue which we call the corpus spongiosum. Then the corpus spongiosum in between actually is on encloses the urethra. Then this is also what we are talking about here. So you can even pause from here. Otherwise, this is a transverse section of the penis. Okay, so let's move. And I'm sure if you've seen, on top of the erectile tissues, you have the dorsal artery, the dorsal vein, and the superficial or subcutaneous dorsal veins as well again. Okay, so this is another structure for the penis. So they have the shaft. So the shaft is mainly composed of the cavernosum. You have the prepuce, which is the foreskin, and the glans, which is the head of the penis. Okay, then you have the crus, you have the bulb. Okay, then from the other view here, the other thing which you have to note for is the frenulum. So the frenulum is somewhere here. Okay, that's another structure. You can pause just in case there's something you might be interested in checking. Okay, then there's just in between the frenulum, or just beside the frenulum, there is also an opening of the preputial gland or the Tyson gland. Okay, then again, so we have a lot of structures that people at least understand this. Okay, so the head is the glans of the frenulum, you have the shaft of the penis, the scrotum. Okay, then you have the corpus cavernosa, corpus spongiosum. I think now people are now familiar with the structures. Okay, so arterial blood pressure or arterial blood is supplied by the deep dorsal and the bulbar arteries of the penis, which are branches from the internal pudendal arteries. Then a series of veins drain blood to the internal pudendal artery and the internal area. In terms of veins, the veins drain blood to the internal pudendal and internal iliac veins. Okay, then the penis is supplied by autonomic and somatic nerves. Then you have a parasympathetic stimulation, which leads to filling of the spongy erectile tissue with blood, which is caused by the arteriolar dilatation and venoconstriction, which increases blood flow into the penis and obstructs outflow. Then the penis therefore becomes engorged and it becomes erect. Then an essential prerequisite for coitus to occur. So in short, this is an essential prerequisite for coitus to occur, the erection and the engorgement and therefore erection of the penis. After, of course, there is dilatation and venoconstriction. Then, of course, the blood, which increases blood flow to the penis and obstructs outflow. So, meaning more blood will be going to the penis, and whilst less blood will be going out of the penis, so that the penis should become engorged and it erects now for coitus. Okay, so we are done with the external organs of the penis. Let's now look at the internal organs. So the internal male reproductive organs and structures include the following. You have the spermatic cord, you have the seminal vesicles, you have the ejaculatory ducts, you have the prostate gland, and you also have the urethra. So now let's look at each in turn, starting with the spermatic. So the spermatic cord, so each cord contains the following. You have the testicular artery, So this branches from the abdominal aorta just below the renal arteries. Then you have the testicular vein, and this passes into the abdominal cavity, and the left vein opens into the left renal vein, and the right vein into the inferior vena cava. Then in terms of lymph drainage, this drains through the lymph nodes around the aorta. Then you have the different ducts, which is about 45 centimeters long. It passes upward from the testis through the inguinal canal and ascends medially towards the posterior wall of the bladder, where it is joined by the duct from the seminal vesicle to form the ejaculatory duct. Then the nerve supply, this is provided by branches from the 10th and 11th thoracic nerves. Then all these blood vessels, nerves, and structures come together to form the various origins in the abdomen to form the. So in short, in summary, we are saying there is what we call the rule of threes. There are three coverings. We have them. I usually use the mnemonic ICE. So ICE, ICE. I for internal spermatic fascia, C for cremasteric fascia, then E for external spermatic fascia. Those are the coverings. Then for the arteries, they use the mnemonic ACT, ACT. A for artery for the artery to the vas deferens, C cremasteric artery, T testicular artery. Okay, so ICE, ACT. Then for the veins, good part for the veins, yeah, you don't necessarily have to have a mnemonic, but you just have to know that the names of the veins correspond to the names of the arteries. So in short, there's a vein to the vas deferens, there's a cremasteric vein, there's a testicular vein. But altogether, the veins form what we call a pampiniform plexus of veins. Okay, that's about veins. Then the last content are the nerves. The nerves mnemonic I use is SIG, S-I-G, S-I-G. S for sympathetic nerve, I for ilioinguinal nerve, then G for the genital branch of the genitofemoral nerve. Okay, so these are the contents of the somatic cord. Okay, so meaning these are actually contents from the covering, from covering, as well as what's now inside the somatic cord. Then the other structures that we have, we can also have other structures such as the vas deferens, the lymphatics, and the processus vaginalis. Okay, so we are done. So we are done about the contents of the spermatic cord. So this is also just another picture to show you about this three fascia, three arteries, three veins, three important structures, and the three nerves. And of course, if you notice the structures, I haven't really added any mnemonic for the structures, but just know that there's a vast difference in males, a round ligament in females, and of course, if there is hernia, then you can even have hernia sac. And of course, don't forget about the lymphatics as well as one of the structures found inside the spermatic cord. Okay. Then next is the seminal vesicles. So the seminal vesicles, so these are the seminal vesicles, the ones looking here. So these are the seminal vesicles to be specific. Then this is the ampulla of ductus. Okay, this is the ampulla of the ductus, or the ampulla of vas deferens, or the ampulla of ductus deferens. Then these are the seminal vesicles. So, but specifically here, we're going to talk about the seminal vesicles. So the seminal vesicles are two small fibrous pouches lined with the columnar epithelium. They lie on the posterior aspect of the bladder. At its lower end, each seminal vesicle opens into a short duct which joins with the corresponding different duct to form an ejaculatory duct. Okay, then what are the functions of the seminal vesicles? The seminal vesicles contract and expel seminal fluid during ejaculation. Then seminal fluid forms 60% of the bulk of the fluid ejaculated during a male orgasm. Then it contains nutrients to support the sperm during their journey through the female reproductive tract. So in short, here we are saying, if you have ever heard of the word semen, semen and seminal fluid are two different things. So semen is now the more like the composition of the seminal fluid, the milky part, and as well as the sperm cells. That is semen. But for the seminal vesicles, they produce now the fluid part, the seminal fluid, okay, which forms the 60% of the fluid ejaculated during a male orgasm. And this same fluid we are saying here is that it contains nutrients to support the sperm during its journey through the female reproductive tract. Yes, so the seminal fluid has nutrients, in short. That's what we are saying here. But those nutrients have to be used by the sperm cells during their journey. Then next structure is the ejaculatory duct, which of course just below the seminal vesicle duct, and to join together. And so the different duct and the seminal vesicle duct join together to form, or join together inside to form the ejaculatory duct. Okay, then the ejaculatory ducts are two tubes about 2 centimeters long, each formed by the union of the duct from a seminal vesicle and a different duct. Then they pass through the prostate gland and join the prostatic urethra, carrying seminal fluid and protozoa to the spermatozoa to the urethra. I don't know why I said protozoa. Spermatozoa to the urethra. Okay, my God. Okay, so the ejaculatory ducts are composed of the same layers of tissue as the seminal vesicles. So the in terms of tissues, the ejaculatory ducts are the same layer as the seminal vesicles. Another structure now is the prostate. So this is the prostate which I'm pointing here. The prostate gland lies in the pelvic cavity in front of the rectum and behind the syphilis pubis. It surrounds the first part of the urethra. It consists of an outer fibrous covering, a layer of smooth muscle and glandular substance composed of columnar epithelial cells. So what are the functions of the prostate gland? The prostate gland secretes a thin, milky fluid that makes up the 30% of semen and gives it its milky appearance. So me, I just call it a milky fluid to be specific. So remember we said the seminal vesicles produce the 60% of the fluid. Then the prostate now adds the milky part. Now the milky part is 30%, and remember the seminal vesicles we are saying just produce a milky fluid. So the prostate adds now the milky appearance now. So that's why sperms actually look milky due to the secretion from the prostate. Okay, and this is a very good structured question. I just ask it. The duct gland secretes a thin, milky fluid that makes up 30% of the semen and give it its milky appearance. That's where now people find they'll be giving wrong answers. So remember, prostate gland. Okay, then this same milky fluid, it is slightly alkaline, which provides a protective local environment for sperm arriving in the acidic vagina. It also contains a clotting enzyme which thickens the semen in the vagina, increasing the likelihood of semen being retained in the vicinity of the cervix. Okay, so we are done with the prostate. Let's look at the urethra. So the male urethra provides a common pathway for the flow of urine and semen. I think in the previous lecture about the urinary system, I think we discussed about the urethra both in males and females. So in males, it's about 18 to 20 centimeters, and other literatures will tell you it's about 18 to 22 centimeters. Or you know that it's actually long, and it consists of three parts. So we have the prostatic urethra, which originates at the urethral orifice of the bladder and passes through the prostate. So that's why they call it a prostatic urethra. The membranous urethra is the shortest and narrowest part and extends from the prostate gland to the bulb of the penis. Then, after passing through the perineal membrane, the last part of the urethra is the sponge or the penile urethra, which lies within the corpus spongiosum of the penis and terminates at the external urethra orifice in the glans penis. Then they are two urethral sphincters. The internal sphincter consists of the smooth muscle fibers at the neck of the bladder above the prostate gland. Then you also have the external urethral. They have the external sphincter, which consists of the skeletal muscle fibers surrounding the membranous part. Okay, so those are the urethral sphincter. So in summary, what are we saying about the prostate? So we are saying the urethra. We are saying the urethra as the prostatic urethra. There is also a membranous urethra. Then you also have a spongy or penile urethra. The sponge or the penile urethra, which is found on the anterior part, as one, the bulbar urethra, as the penile urethra. That's what we are saying. So this is the spongy urethra. This is one. Okay. Then let's look at the accessory sex organs. So the ducts of the male reproductive system store and transport sperm cells, but the accessory sex glands secrete most of the liquid portion of semen. Then the accessory sex glands include the seminal vesicles, the prostate, and the bulbourethral glands. Then the paired bulbourethral glands or Cowper's glands are about the size of peas. They are located inferior to the prostate on either side of the membranous urethra within the deep muscles of the perineum, and their ducts open into the spongy urethra. These are the accessory sex organs found in the male reproductive system. Okay, so now let's talk about an interesting physiology, which is erection. So upon sexual stimulation, so be it visual, tactile, auditory, olfactory, or imagined, parasympathetic fibers from the sacral portion of the spinal cord initiates and maintain an erection. Then the enlargement and stiffening of the penis. Then the parasympathetic fibers release and cause local production of nitric oxide. Then the same nitric oxide causes smooth muscle in the walls of the arterioles, supplying the erectile tissues to relax, which allows these blood vessels to dilate. This in turn causes a large amounts of blood to enter the erectile tissue of the penis. The nitric oxide also causes the smooth muscles within the erectile tissue to relax, hence resulting in widening of the blood sinuses. Then the combination of increased blood flow and widening of the blood sinuses result in an erection. So meaning more blood is flowing to the penis, whilst less is outside, flowing out of it. Okay. Then the expansion of the blood sinuses also compresses the veins that drain the penis. Hence the slowing of the blood outflow helps to maintain the erection. So this is more of an creative learning, so that at least you see how that actually occurs. So please enjoy the video, and please the credit don't go to me. I'm not the owner of this video. I wanted to use this for learning, so that at least you are not just bored with my voice. Of course, at least you see how an erect penis looks like, if of course you haven't even seen one.
In today's video, with the help of 3D animation, we will explain the entire process of penis erection in detail. Firstly, we cut the penis from the front to see its internal structure. After cutting, we can see that there are many veins on the upper part of the penis. In the middle part, there are two large tubes called corpora cavernosa. At the bottommost part, there is a tube called carpus spongiosum, which contains the urethra from where urine and sperm are ejaculated. Where the penis is not erect at that time, at least a small amount of blood flows through the corpora cavernosa, and the veins on the upper part are opened and filled. At this time, the penis is soft and flexible. Now let's see what exactly happens that makes the penis erect and increases in size. When a person gets aroused for sex, there is increased blood flow to the corpora cavernosa of the penis, which causes it to expand and increase in size. As a result of this increase in size, the upper blood vessels of the penis gets compressed, which obstruct the flow of blood. Due to this obstruction in the blood flow, the pressure of the blood increases, which makes the blood vessels tight and also makes the penis erect and increase in size. I hope you understand this topic. If
Okay, so that's the video. Thank you for watching, and let's now continue with our lecture. Hope you enjoyed the video. If you did, give us a comment, give us a like, share the video to people you think are actually going to benefit from this. Okay, so we are done with erection. Let's talk about ejaculation now. So during ejaculation, which occurs at the point of male orgasm, spermatozoa are expelled from the epididymis and pass through the different duct, then from the different ducts to the ejaculatory duct, and finally through the urethra. Then the semen is propelled by the powerful rhythmic contraction of the smooth muscles in the walls of the different ducts. Then the muscular contractions are sympathetically mediated. Then the muscles in the walls of the seminal vesicles and prostate gland also contract, adding their contents to the fluid passing through the genital ducts. Then the force generated by these combined processes lead to emission of the semen through the external urethral sphincter. Then sperm comprises only 10% of the final ejaculate, the remainder being made up of the seminal and the prostatic fluids. So now we have the 100% now. So in short, remember we said seminal fluid are 60%, the milky part is 30%. Then now the sperms themselves are 10%. So together these three are what we call semen in short. Okay. So which are added to the sperm during male orgasm. So the sperm, the milky part, the prostatic fluids, which are the milky part, and the seminal fluids are added to the sperm during male orgasm. Then the fluid also contains mucus, which is produced in the urethra. Then between 2 and 3 mils of semen are produced in a normal ejaculate. The semen contains between 40 and 100 million spermatozoa per mil. Then if not ejaculated, sperm gradually lose their fertility after several months and are reabsorbed by the epididymis. And don't confuse semen and the seminal fluid, the prostatic fluid, okay, and sperm. Hope you are not confusing this. Okay, hope you have understood. Okay, then ejaculation, which is of course the powerful release of semen from the urethra to the exterior, is a sympathetic reflex coordinated by the lumbar portion of the spinal cord. Then as part of the reflex, the smooth muscle sphincter at the base of the urinary bladder closes. So this prevents urine from being expelled during ejaculation and the semen from entering the urinary bladder. Okay. Then even before ejaculation occurs, peristaltic contraction in the epididymis, the ductus deferens, seminal vesicles, ejaculatory ducts, the prostate, propel semen into the penile portion of the urethra, specifically the spongy urethra. Then typically this leads to emission, the discharge of a small volume of semen before ejaculation. Then emission may also occur during sleep, which we call nocturnal emission. Okay, so that's nocturnal emission. Then the musculature of the penis, which is the bulbospongiasus, the ischiocavernosus, and the superficial transverse perineus muscles, which is supplied by the pudendal nerve, also contracts at ejaculation. Then once sexual stimulation of the penis has ended, the arterioles supplying the erectile tissues of the penis constrict, and the smooth muscles within erectile tissue contracts, making the blood sinuses smaller. Okay, so this relieves pressure on the veins supplying the penis and allows the blood to drain through them. Consequently, the penis returns to its flaccid or relaxed state. Okay, so again, we also have another illustration of how ejaculation occurs. Okay, so unfortunately, there is no voice here, so I'm the one who's going to take you through. So I will be using this pointer. So sperms are traveling through the ductus deferens, and here the seminal adds the seminal fluid, then the prostatic fluid the prostate adds the prostatic fluids. After the prostate has added the prostatic fluid, then together you are going to have 10% sperms, 30% the prostatic fluids are the milky part, then 60% you are going to have the seminal fluid, and they are going to be ejaculated. So that's actually what happens. Okay, so let's now look at semen. So what really is semen? So of course we have identified that semen is made up of 10% sperms, then 30% the prostatic fluid, the milky part, and 60% the seminal fluid. So the semen is a mixture of sperm, seminal fluid, and the liquid that consists of the secretions of the seminiferous tubules, seminal vesicles, prostate, and the bulbourethral glands. And the volume of semen in a typical ejaculation is 2.5 to 5 millimeters, or 5 mils. So it's supposed to be the same 2.5 mils to 5 mils. So that same 2.5 to 5 millimeters is actually contains about 50 to 150, should contain about 50 to 150 million sperm per mil. Then when the number falls below 20 million per mil, the male is likely to be infertile. Okay, then a very large number of sperm is required for a successful fertilization, because only a tiny fraction ever reaches the secondary oocyte. Then despite the slight acidity of the prostatic fluid, semen has a slightly alkaline pH of 7.2 to 7.7 due to the higher pH and larger volume of fluid from the seminal vesicles. The prostatic secretions give semen a milky appearance, and the fluids from the seminal vesicles and bulbourethral glands give it a sticky consistency. Then the seminal fluid provides sperm with a transportation medium, nutrients, and protection from the hostile acidic environment of the male's urethra and the female's vagina. Then once ejaculated, liquid semen coagulates within 5 minutes due to presence of clotting proteins from the seminal vesicles. Then the functional role of semen coagulation is not known, but the proteins involved are different from those that cause blood coagulation. So in short, here we are saying sperms after 5 minutes are actually starts to coagulate, but the role of coagulation is not known, and the proteins that are found in blood coagulation are different from the proteins found in semen coagulation. Okay, then after about 10 to 20 minutes, semen liquefies because the prostatic specific antigen, which is PSA, and other proteolytic enzymes produced by the prostate breaks down the clot. Then abnormal or delayed liquefaction of the clotted semen may cause complete or partial immobilization of sperm, thereby inhibiting their movement through the cervix of the uterus. So in short, here we are saying after the sperms have coagulated, again after another 10 to 20 minutes, then they are going to be liquefied so that now they can continue their movement. But there's times when this movement can be inhibited, where now due to an abnormality or due to some unknown reason that has failed, there is a complete or partial immobilization, or there is a failure to liquefy, then that's the problem. Okay, so let's continue from where we ended. Okay, so the presence of blood in semen is called hemospermia. Then in most cases, it is caused by inflammation of the blood vessels lining the seminal vesicles. It is usually treated with antibiotics, especially maybe we find that maybe there is just due to an infection due to bacteria. So again, we have another video to just make you understand about this topic.
The journey of a sperm cell is an incredible feat of biology, involving complex processes and intricate pathways.
Very much.
In this video, we will explore the path of a sperm cell from the seminiferous tube to the outside of the penis. The male reproductive system is composed of several organs, including the testes, epididymis, vas deferens, prostate gland, and seminal vesicles. It is responsible for producing and transporting sperm cells to the female reproductive system during sexual intercourse. In our previous video, we explained the complete process of penis erection. If you haven't watched that video, then click on the I
So
button and watch
for
it.
this one specifically, you
The
can
journey of a sperm cell begins in the testes. Inside the testes, there are tiny tubes called seminiferous tubules, where sperm cells are produced through a process called spermatogenesis. You'll be surprised to know that in this process, sperm are produced at a rate of several hundred million per day, from puberty into old age. If you want to understand the entire process of spermatogenesis, please let me know in the comments. I will make a separate video on this process. Once a sperm cell is produced, it moves through the seminiferous tubule and into the epididymis, where it matures and becomes motile. The epididymis is a long, coiled tube that sits on top of the testes. It is responsible for storing and maturing sperm cells before they are ejaculated. Once a sperm cell has matured in the epididymis, it is ready to be ejaculated. During sexual arousal, the muscles in the vas deferens contract, pushing the sperm cells out of the epididymis and into the vas deferens. The vas deferens is a long, muscular tube that connects the epididymis to the urethra. It is responsible for transporting the sperm cells from the epididymis to the urethra. As the sperm cells move through the vas deferens, they mix with fluid from the prostate gland and seminal vesicles. These fluids provide the sperm cells with the nutrients and energy they need to reach their destination. Finally, the sperm cells enter the urethra, the tube that runs through the penis and leads to the outside of the body. During ejaculation, the muscles in the urethra contract, pushing the sperm cells out of the penis. And that's the incredible journey of a sperm cell from the seminiferous tube to the outside of the penis. It's a complex and fascinating process that allows for the continuation of life.
Okay, so hope at least now we have finally grasped the concept of the male reproductive system. This is the easiest system you can know by heart. Okay, so let's continue. So the other thing I just have to talk about is puberty. So puberty occurs between the ages of 10 and 14, again just depending on the literatures, but otherwise for males it's this is the commonest range I've seen. Then the luteinizing hormone from the anterior pituitary gland stimulates the interstitial cells of the testes to increase the production of testosterone. Then this hormone influences the development of the body to sexual maturity. And remember, when you say interstitial cells of the testes, we are referring to the Leydig cells. So don't confuse where we put Leydig, where we put the interstitial, they are just the same. Okay, so after that, the changes which occur at puberty are we have growth of the muscle and bone, and a marked increase in height and weight, enlargement of the larynx and deepening of the voice, usually referred to as the voice breaking. Then there's also growth of hair on the face, axillary, chest, abdomen, and the pubis. There's enlargement of the penis, scrotum, and prostate gland. Then there's maturation of the seminiferous tubules and production of spermatozoa. Then the skin thickens and becomes more oily. Okay, then in males, fertility and sexual ability tend to decline gradually with age. Then the secretion of the testosterone gradually declines as well, usually beginning at about 50 years of age. Then males do not experience a period of comparable to female menopause, meaning even if there is a decline, a man can still actually father children still. Okay, that's what we are saying. Then the male sex hormones as a group are called androgens. The principal androgen is testosterone, which is secreted by the testes. Then a small amount is also after produced by the adrenal cortex, and the production of the testosterone begins during the fetal development, continues for a short time after birth, then nearly ceases during childhood, and then resumes at puberty. Then this steroid hormone is responsible for the growth and development of the male reproductive structures, increased skeletal and muscular growth, enlargement of the larynx and accompanied by voice changes, growth and distribution of body hair, increased male sexual drive. Then also you have to know that testosterone secretion is regulated by a negative feedback system that involves releasing hormones from the hypothalamus and gonadotropins from the anterior pituitary gland. Okay, so we are now at the checkpoint. Okay, so they are give out some questions, and I want to start give out the answers. So in short, at least I ask you things so to see if you actually have gotten something. Okay, so these are the questions. Number one, can you describe the function of the scrotum in protecting the testes from the temperature fluctuations? Okay, describe the internal structure of the testes. Where are sperms produced? What are the functions of the Sertoli cells and the Leydig cells? Describe the principal events of spermatogenesis. And this one usually, principal events of spermatogenesis, we are actually going to learn it during even embryology. We are going to learn it. But for now, you have to now check it out. Okay, can you identify parts of the sperm cell and list the functions of each? What are the roles of follicle stimulating hormone, luteinizing hormone, testosterone, and inhibin in the male reproductive system? How is the secretion of these hormones controlled? Okay, then which ducts transport sperm within the testes? Describe the location, structure, and the function of the ductus epididymis, ductus deferens, and the ejaculatory duct. Then give the locations of the three subdivisions of the male urethra. Trace the course of sperm through the system of ducts from the seminiferous tubules to the urethra. List the structures within the somatic cord. What is priapism? what is premature ejaculation, then briefly explain the locations and function of the seminal vesicles, the prostate, and the bulbourethra or the corpus gland. What is semen? What is its function? Lastly, but not the least, explain the physiological processes involved in erection and ejaculation. Okay, so these are the checkpoint questions. Hope at least you get there are 15 questions. I hope at least you get 25% and above. So meaning from what I was mentioning, do you know more than 11 questions here? Okay, so for you to say, okay, I can answer specifically these ones. Okay, so thank you for watching. If you haven't subscribed, subscribe and the bell notification. And of course, see you on the next tutorial video. So next we are doing the female reproductive system. Please make sure to watch.